Hello, so we are back to discuss the second DEU module, Situated Coaching Strategies. This is where we will discuss some clinical situations that could occur and how those might be handled. Okay, the first one is dress code. A student comes to clinical with multiple piercings and visible tattoos. The DEU faculty was busy talking to another student and has not yet seen this current student. So what will you, as the DEU nurse, say to the student or respond in this setting? One thing to keep in mind is that Lasting Hope has a dress code policy, as does Methodist College. And the fact is, they're probably very similar. So the student should realize that it's in violation of the college policy, and therefore probably is in violation of a hospital policy as well. But that realization did not occur, apparently. So what will you, as the DEU nurse, say to the student? How will you respond? Why don't you just take a couple moments, and as we're discussing these situations, jot down some of your responses or some of the questions that you have about the circumstances so that we can discuss that when we get together before the semester begins. The second situation also relates to dress code, where a student comes in on week 1 with black nail polish and is told that she needs to follow the NMC dress code policy. And she's told that by the DEU faculty, which is me. And then she comes to clinical week 2 with dark blue nail polish. Now, I don't know what Lasting Hope has to say about dark blue nail polish. I do, however, know what Methodist College policy has to say about those types of colors for nail polish in clinical settings, and they are not acceptable. So, the first week, apparently, was black nail polish and was told they needed to follow the dress code. So when they come back, they've made a minor modification, but it's really not enough to be satisfactory. So what's going to happen next? And what will your role be in addressing this if the DEU, if the college nursing faculty is not readily available? Then we move into medication errors or potential errors. And so the first situation is metoprolol, 12.5 milligrams PO daily. The student pulls a 25 milligram tablet and administers the full tablet. At some point, you as the DEU nurse will be following up with that student, and you and the student will realize what occurred. How will this be addressed? Again, the thing to keep in mind here is that the Lasting Hope has a policy that is expected to be followed by everybody, staff as well as nursing students. So that's where we need to go with that. But what will be most helpful, I believe, is if you just include the student right in the follow-up documentation and response, because the student needs to understand the significance of the error, recognize that it was an error, and what happens next. Another medication error is the next one, where you and your student are busy with an emergent situation, and so we're unable to give the antibiotic that was ordered for 1 o'clock, and it's ordered every 6 hours, and it is now 2:05. How will you handle that? What's the discussion going to be like as you talk with the nursing student about this? And what will be the follow-up actions? Again, just jot it down, and we will discuss when we get together at the beginning of the semester. Okay, attitude and incivility. I wish that these things didn't come up, but we don't live in a perfect world, and sometimes they do. So the first situation is where a student arrives to clinical 10 minutes late, saying that he or she was up all night with a sick child. The student appears irritable and is in fact rude to the care staff after morning report. Okay, so what kinds of questions do you have about this situation? I guess the first question that comes to my mind is coming to clinical 10 minutes late probably means that the student maybe didn't even get in to report, or if they did, they got in late. So that's an issue right there. And then the fact that the student is irritable and explains why causes me to wonder what needs to happen here, and what is your suggestion or your response going to be as the DEU staff nurse for that student? Are they going to stay? Are they going to be sent home? At what point are you going to intervene? And at what point might you direct the student toward the nursing faculty? Again, just something to consider in terms of how you would respond to the circumstances. And then the second one is pulling a student aside to discuss poor performance of a procedure, and the student becomes defensive and starts crying, saying, "It's not my fault. I've never done this in real life before." Oftentimes what the client will actually say is, "I've never worked with these kinds of patients before." And at that point, one might question, does it matter if it's a client with a mental illness or if it's a client recovering from surgery? I mean, does it matter? The defensiveness and the tearfulness is certainly something to be addressed with the student right then and there in a way that doesn't promote continued defensiveness, but does allow the opportunity to dialogue and give the opportunity for the student to actually identify what maybe went awry in the procedure and how it could be handled differently and what should happen next. Once again, we're back on some medications, and this is the one where the student comes to you at 8:45 and says they can't get the medications out of Pyxis. So what happens next? Obviously, if the meds are probably due at 9, it's possible that you might be able to get in there and help the student rectify the situation. Again, we don't know what all of your options would be, but what can you see yourself doing under these circumstances? And what would you be telling the student? And then the next situation is the student tells you that he or she is ready to administer the 9 a.m. meds, and in fact, they're all ordered PO. What happens next? What do you want to do in regard to this situation? What do you want to tell the student? How will you follow up? And then the next one is talking about lithium administration, and it's the patient's first dose. So the student has the medication and is ready to administer. What do you want to check with that student on? What are some of the expectations for the student prior to administering this med? This is a wonderful teaching opportunity in relation to looking at lab work, in relation to looking at assessment data, and recognizing what needs to happen in regard to teaching for a client who is starting on a new medication. And then patient assignments, and this might be a little heavier than usual. I don't know that a student would necessarily be working with 4 patients. However, you could well be working with 6 or 8 patients, and 4 of them are the ones listed on this assignment here. A patient with bipolar being discharged, a new admission with acute exacerbation of schizophrenia, a recently admitted patient with suicidal ideation, and a patient awaiting transfer to substance abuse. So if this is the caseload that you're working with or wanting to share with the student, how will you help direct the student? How will you help promote division of labor and prioritization of care? And how would you explain the rationale for the priorities that were determined? Again, prioritization is such an essential piece of nursing care, and it'll be a wonderful learning opportunity if you can include the student in that dialogue. Who is the priority patient here? what level of care is needed, who can take a back seat or be followed up by someone else, that kind of discussion. Then we move into some other challenging situations, such as a student is assigned 2 patients. It's 11:58, it's 9 a.m., excuse me, and your student is working on their pathodiagram. Now, pathodiagrams are an important thing for a student to process and to learn. It helps them put together what's going on with the disorder and how it's affecting different aspects of the client's life and experience and assessments. So that's valuable. However, it's 9 a.m. and the meds have not been administered, and the 8 a.m. assessments have not been documented. Clearly, this is a situation that calls for some clarification and asking the student, how were they prioritizing what needed to happen here? And were they actually thinking about the priorities for the client, or perhaps some other priorities? And how do you correct the situation, and what is the follow-up? A lot of times when things aren't going the way you intended, the follow-up becomes really important. Who's going to do what, when, and how? And certainly that's what you'd want to have a discussion with the client, with the student here about. Meds haven't been passed, assessments were not documented, we don't even know if those assessments were done. So again, this calls for a reminder that you might be delegating to your student after a period of time, but even with that, you still need to stay pretty nearby to see what's going on. The next situation is a stat medication to be administered at 10 a.m. It's now 10:35 and your student has been in the room visiting with the patient and her daughter for 20 minutes. When you notice that, what's going to be your response? And how will you deliver it to the student? Are you going to take the student aside? Are you going to confront the student in the room with the client sitting there? What are your options for responding to this? And again, what happens next? Where's the accountability, and what is the follow-up? Those seem to be the areas that we always need to be considering, and I'm sure that as you're doing your nursing care, those are areas that you think of almost unconsciously. When something occurs, you just immediately think about, okay, what happens next and how are we going to do this? But with the student, it's not an immediate process. And so if you can take a step backward enough to actually discuss with the student what the circumstances are, what contributed to the circumstances, what is the outcome right now, and what needs to happen. Another challenging situation. Week 3 and your student has difficulty identifying symptoms and medication effects. So when you take the student aside to discuss their clinical progress at this point, the student says they don't see a problem and believe they're doing a great job in clinic. Well, I suspect that the student's self-perception and your perception of the student are not consistent. They're not congruent. And so at this point, it calls for some of the techniques that we talked about in our earlier session about saying, I've noticed this, or I was expecting to see thus. And you might also have a conversation such as, what do you remember, or what have you learned about this condition, and what symptoms are important to assess, and what effects would you be looking for when the client is on medication to treat that. So again, you're turning it into a learning situation, but you're also letting the student know that they need to be processing, they need to be taking some responsibility for understanding and learning and understanding the material in the classroom that then can transfer into the clinical situation. If we look at the next situation about a patient who complains of increased anxiety and in fact does have elevated blood pressure and pulse. So in this situation, you might ask the student, Do you think the client needs a PRN? Or were you going to offer a PRN? Or what does the client get for a PRN? And when you initiate that conversation, the student then states, well, everyone said he's med seeking, so I really didn't think he needed it. Now, this is certainly an issue that needs to be clarified and addressed. It is possible that the student has heard other people say, well, that client is med seeking. However, there's another part of the thought process and the assessment process that needs to go along with this rather than merely dismissing it. And I know you know that, but it's obvious from the student comment that they don't know that. So once again, it's a great teaching opportunity to help the student dismiss previous comments that may or may not be effective or helpful and say, what is going on with the client? What do you see? What needs to happen next? How will you follow up? Here's another challenging situation. A student is assigned to a patient who had an emotional family meeting in which the client's family members said they don't feel the client can return home because of concerns for safety of client and family. The physician just told the patient they'll have to find other living situations for him or her. Probably the client is going to remain on the unit another day or two as they secure those options. The client becomes tearful and distraught during that conversation, and later you see that the student is in the lounge crying. What do you think is going on here? What would account for the tears in the eyes of that student nurse? And how are you going to help the student process that to be able to intervene effectively and positively, and recognizing that sometimes we are put in difficult positions that we need to respond to professionally and promptly. So once again, taking the time to identify what's going on with the client and what's going on with the student, and then seeing how you can proceed from there. One more challenging situation. A student is assigned to a client who has bipolar disorder and was reported to be responding well to their mood stabilizer. After 2 or 3 hours, you notice that the student documented that the patient was labile, irritable, and unable to redirect. You ask the student who they reported this change in behavior to and what their plan was, and the student states, I read in the book that mood changes happen often with this diagnosis, so I didn't think it was a big deal. Well, again, this is a wonderful learning opportunity because the student has been doing some reading. The student does have some information that changes happen often in mood with this kind of diagnosis, but the student kind of made a huge leap by saying, well, the text says that it happens, so I don't think we need to treat it. It's kind of just a common thing. Well, that is not what the text actually said, even though the mood lability is a frequently seen occurrence. We need to be doing something. So if the student didn't think that there was anything to report or anything to respond to, again, we need to discuss this. And it may not be necessarily offering medication. It might be furthering assessment or looking into other options. But again, the student doesn't necessarily have enough information or knowledge base to realize that. And so it's really important to take the time to have that conversation with the students so that they can make better informed judgments. And then lastly, a newly admitted client is transferred to special care due to increasing agitation and inability to redirect. That patient is now pacing the halls and has occasional outbursts and has refused all morning medications. The patient has lorazepam ordered, PO or IM, and Haldol ordered, PO or IM. And the student is sitting in the dining area trying to talk with patients. As you, the nurse, look onto the unit and see the situation, what would you do first? And how do you make that decision? And what is going to be the student's role or involvement in this situation? Where do you want that student to be? What would you like to see the student doing? And again, it might be that you intervene and then pull the student in on a conversation. You've got options here. Which one will you take, or how will you prioritize? And then having that conversation with the student to help discuss how you made those decisions will be very, very helpful. So challenging situations, we know they occur, and we also know that they can be wonderful learning opportunities when you can take the time to help the student process them and reach a new level of understanding. So that concludes this portion of the situated coaching strategies, and we'll be moving into the next module very shortly. Thank you very much, and we'll be in touch soon.